Looking for a powerful way to lower your cholesterol? Rozit combines two proven medications in one daily pill. Here's what you need to know fast. Rozit, Rosuvastatin/Ezetimibe, what you need to know. What is Rozit? Rozit is a prescription medication that combines two powerful cholesterol-lowering agents, rosuvastatin and ezetimibe. This dual-action formula tackles cholesterol through two different mechanisms, offering a comprehensive approach for managing high cholesterol. Taken once daily by mouth, Rozit is also available in generic form, often making it more affordable. What is Rozit used for? Rozit, rosuvastatin/ezetimibe, is typically prescribed as an adjunct to diet in the treatment of high cholesterol, especially in cases where statins alone are not enough. Homozygous familial hypercholesterolemia, HoFH, either alone or in combination with other lipid-lowering treatments. How does Rozit work? Rozit works through a synergistic combination of two agents. Rosuvastatin, a statin, decreases LDL or bad cholesterol by inhibiting cholesterol production in the liver. Ezetimibe reduces cholesterol absorption in the small intestine, lowering the total cholesterol that enters the bloodstream. This complementary action makes Rozit effective for patients requiring more aggressive lipid control. Rozit dosage forms and pricing. Rozit is available in tablet form with various strength combinations. Strength, quantity, approximate, price with coupon. Price per tablet, 5 milligrams per 10 milligrams, 30 tablets, $255, $8.50. 10 milligrams per 10 milligrams, 30 tablets, $255, $8.50. 20 milligrams per 10 milligrams, 30 tablets, $255, $8.50. 40 milligrams per 10 milligrams, 90 tablets, $753, $8.37. These prices reflect discounts using a GoodRx coupon, offering significant savings from the average retail price of $324.62 for a 90-tablet supply of the 20 milligrams per 10 milligram strength. Typical dosage of Rozit. The typical daily dose of Rozit ranges from 5 milligrams per 10 milligrams to 40 milligrams per 10 milligrams, taken once per day by mouth. Your healthcare provider will determine the appropriate dosage based on several factors. Your cholesterol targets, particularly LDL levels. Cardiovascular risk profile, whether you're of Asian descent, as this may influence statin sensitivity. Coexisting kidney conditions. Potential drug interactions. Always follow your prescriber's instructions and never adjust your dosage without medical guidance. What are the side effects of Rozit, rosuvastatin/ezetimibe? Like all medications, Rozit can cause side effects. While many are mild and improve over time, some can be serious and require immediate medical attention. Common side effects. These are more likely to occur and often improve as your body adjusts to the medication. However, if they persist or worsen, contact your healthcare provider. Nasal inflammation or congestion, up to 4%. Muscle pain, 3%. Upper respiratory tract infections, 3%. Joint pain, 3%. Diarrhea, 3%. Other less common but reported symptoms include back pain, pain in arms or legs, fatigue or tiredness. Serious side effects. Seek medical attention right away if you experience any of the following symptoms. 1. Severe muscle damage, rhabdomyolysis, unexplained muscle pain or weakness, dark brown or tea-colored urine, fever, extreme fatigue. 2. Liver problems or liver failure, yellowing of the skin or eyes, jaundice, swelling of the abdomen, confusion or difficulty concentrating, dark-colored urine. These serious effects are rare but potentially life-threatening, so don't ignore warning signs. Pharmacist tips for taking Rozit, rosuvastatin/ezetimibe. If you've been prescribed Rozit, here are key tips from pharmacists to help you use this medication safely and effectively. 1. How to take Rozit. Rozit, rosuvastatin/ezetimibe, can be taken with or without food. Always swallow the tablet whole. Do not crush, chew, or cut it. Altering the tablet may interfere with how the medication is absorbed and how well it works. 2. Stick to a routine. Take Rozit once daily at the same time each day, whether in the morning or at night. If you miss a dose, simply skip it and resume your normal schedule. Do not double up to make up for a missed dose. 3. Alcohol precautions. Limit your alcohol consumption while taking Rozit. Excessive alcohol use increases your risk of serious liver complications, especially when combined with cholesterol-lowering medications like Rosuvastatin. 4. Be cautious with drug interactions. Rozit can interact with several common medications, including cyclosporin Sandimmune in the oral, fibrates, such as gemfibrozil or fenofibrate. These combinations may increase side effects or reduce medication effectiveness. Always inform your healthcare provider about all medications, supplements, and over-the-counter products you're taking. Your dose may need to be adjusted or certain drugs substituted. 5. Timing matters with other medications. If you take bile acid sequestrants like cholestyramine Prevolite or Cosevalum Welchol, take Rozit at least 2 hours before or 4 hours after these medications. This timing helps ensure your body properly absorbs Rozit. If you use antacids containing aluminum or magnesium, wait at least 2 hours after taking Rozit to take the antacid. Taking them together can reduce Rozit's absorption and effectiveness. 6. Monitor your cholesterol levels. Routine LDL cholesterol blood tests are necessary to track how well Rozit is working for you. Your healthcare provider will schedule these labs at appropriate intervals and adjust treatment based on the results. Frequently asked questions about Rozit, Rosuvastatin Ezetimibe. If you're considering or currently taking Rozit, here are answers to some of the most frequently asked questions. 1. What's the difference between Rozit and Vitarin? Both Rozit and Vitarin combine ezetimibe with a statin, but the type and strength of the statin differ. Rozit contains rosuvastatin, which is a moderate to high-intensity statin. Vitarin contains simvastatin, which is generally a low to medium-intensity statin. This means Rozit may be more effective for people who need greater LDL cholesterol reduction. 2. Why is a lower dose recommended for people of Asian descent? Clinical studies have shown that people of Asian descent may have higher blood levels of rosuvastatin compared to non-Asian populations when taking the same dose. This increases the risk of side effects. As a precaution, the recommended starting dose is 5 milligrams per 10 milligrams once daily for individuals of Asian descent, unless your healthcare provider advises otherwise. 3. What's the best time of day to take Rozit? Rozit can be taken at any time of day, morning or evening, thanks to the long-acting nature of rosuvastatin. The key is consistency. Take it at the same time each day to keep your medication levels stable. 4. Can I take Rozit with food? Yes. Rozit, Rosuvastatin Ezetimibe, can be taken with or without food. If you experience stomach discomfort, consider taking it with a meal. Unlike Vitarin, Rozit does not interact with grapefruit, so you don't need to avoid it while on this medication. 5. Can Rozit be used during pregnancy? No. Rozit should not be used during pregnancy due to the risk of harm to an unborn baby. However, cholesterol management is typically not prioritized during pregnancy unless specifically directed by your provider. If you're pregnant, planning to become pregnant, or think you may be pregnant while on Rozit, talk to your healthcare provider about safer alternatives. Want to learn more? For in-depth, doctor-reviewed videos on medications and health topics, subscribe to HeInfo now. Hit the like button if you found this helpful. Drop your questions in the comments. We answer them in future videos. And don't forget to turn on notifications so you never miss an update. Stay informed. Stay healthy. You're watching HeInfo.